like to tell you a few things about CareSouth Carolina. We're located in the PD area of South Carolina, which includes counties from Lee County, Darlington County, Chesterfield, Marlboro, and Dillon County. In those counties, we have 10 medical office locations, which covers a pretty big geographic area. We have about 280 staff folks, including physicians that run a pretty wide range of family practice, pediatrician, internist, and also nurse practitioners. And kind of uniquely to CareSouth Carolina, we also have an integrated model of behavioral health counselors who are on site at every one of our locations. Our organization employs a little over 280 staff people, so we're a pretty large economic industry, an engine for the communities that we're located in and serve. Most of our communities are small, rural-based. Many of them are the county seat of the county that they're located in. And we've been around for quite a while. I've been with the organization a little over 31 years. It's our mission really to meet the needs of those folks who otherwise, because of their uninsured state, would not have access to care. We feel very strongly about being part of the community, and in that we manifest that by participating and holding a lot of health fairs, a lot of community events, organizing and participating with interagency councils, and really representing some of the healthcare needs of the uninsured in as many avenues as we possibly can. We think that being a patient-centered medical home, one who really addresses not just the medical needs, but the whole comprehensive needs of the patient, is really a good description of not only CareSouth Carolina, but the community health centers throughout the nation.
We're excited to have CareSouth as a part of our community, not only because they provide such a needed service to this community, but they're also one of our major employers, employing nearly 100 people in and around the Hartsville community. We're just glad to have such a quality service available here in such a rural municipal setting.
I have been a CareSouth patient for 10 years. It helps that I live right across the street, so I don't have far to travel. But if I had to travel, I would still go to CareSouth because they are a wonderful group of professionals. They are up to date on the latest technology. They are hometown people. They love you. You're not a stranger. I was a diabetic 3 years ago. I was diagnosed as a type 2 diabetic. My HD1C was 10.5. 6 months later, with the help of Millie Grooms, CareSouth professional, it was 5. And I just thank her for it. Millie was there for me to help me with all the information, education I needed about diabetes.
Hello, I am a former CareSouth employee. I now purchase my medication through CareSouth Pharmacy, and it has saved me a tremendous amount of money because purchasing one pack of my birth control pills would have been almost about $30. Now I only pay $8. Woo woo woo. But a surprise, I am so happy about that.
CareSouth through a family member. Because I didn't have no insurance, I was out of work. And I didn't have no insurance or nothing to go to a doctor, so I went to CareSouth. And at that time, they helped me with my visits, my medicine, and my health care. And through the years went on, I found out that I had a triple bypass blockage. CareSouth gave me some help to get to a Dr. Block in Longbury, North Carolina. After I got to Dr. Block, they did the dye through my heart and found out I had a blockage in my heart. When it came out, I ended up having a triple bypass heart surgery. Through CareSouth, they had a funding that gave me help, and without that help, I really don't think I would be here today. I love CareSouth. I will always be with them.
As a primary care physician in the state of South Carolina, I would like to thank all of the legislators for their continuing support of primary care in the state of South Carolina. As most of you know, a good portion of our state is considered rural, and most of our state is considered underserved. These patients and citizens are mostly underserved in the area of chronic illness. Unaware to most legislators, today's medicine is not necessarily focused on intermittent devastating disease, but more so the marathon and continuing efficient care of chronic illness. Without continual care of chronic illness, a lot of our citizens would suffer from greater loss of life, greater loss of income, and debilitating disease that is completely preventable. And without your support, none of this chronic care is possible. So again, I would like to thank all of the legislators for their continuing support of primary care in our state, and in particular our community health centers, which are our safety net delivery system of care. Thank you.